Hey guys, Dr. Mike here. Have you ever heard of a brain aneurysm? It's more common than you might think, and it can be a silent threat. Basically, it's a weak spot in a blood vessel in the brain that balloons out and fills with blood. Now, most aneurysms don't cause any noticeable symptoms, but if they rupture, it can be life-threatening. That's why awareness is key. Early detection can make all the difference. In this video, we're going to dive deep into the world of brain aneurysms. We'll explore what they are, the warning signs you should never ignore, and what you can do to protect yourself. And because knowledge is power, we'll also discuss some famous figures who tragically lost their lives to this condition, reminding us just how important it is to stay informed. So stay tuned, hit that subscribe button, and let's get started. All right, let's break down what a brain aneurysm actually is. Imagine the blood vessels in your brain are like a network of pipes. Now imagine one of those pipes developing a weak spot that starts to bulge outward. That bulge, my friends, is an aneurysm. Now, there are different types of brain aneurysms. The most common type is called a saccular aneurysm, which looks like a little berry hanging off the blood vessel. Then you have fusiform aneurysms, which affect the entire circumference of the blood vessel, making it look like a swollen balloon. So what causes these weak spots to form in the first place? Well, it's often a combination of factors. High blood pressure, for example, puts extra stress on your blood vessels, increasing the risk of aneurysm development. Smoking is another big one. We all know smoking is bad for you, but it's especially harmful to your blood vessels. Other risk factors include high cholesterol, atherosclerosis, that's the buildup of plaque in your arteries, and even some genetic conditions. The important thing to remember is that aneurysms can happen to anyone, regardless of age or health status. Now here's the thing about brain aneurysms. Most of the time that they don't cause any symptoms at all. They can silently lurk in your brain for years without you even knowing it. This is a big, but if an aneurysm grows large enough, it can start to press on surrounding nerves or brain tissue, leading to a whole host of problems. And in the worst-case scenario, an aneurysm can rupture, causing bleeding into the brain, which is a medical emergency. We'll talk more about the symptoms of a ruptured aneurysm in just a bit, but first let's move on to Chapter 2, where we'll discuss how to recognize the warning signs of a brain aneurysm. Stay with me. Brain aneurysms can be silent troublemakers, often causing no symptoms until it's too late. But sometimes our bodies give us warning signs. It's crucial to know what to look out for. One common symptom is a sudden severe headache. This isn't your typical tension headache. It's often described as the worst headache of my life. You might also experience nausea, vomiting, stiff neck, light sensitivity, and blurred vision. These symptoms indicate the aneurysm is growing and putting pressure on the brain. If an aneurysm ruptures, it's a life-threatening emergency. Symptoms of a ruptured aneurysm are sudden and severe. Think intense headache, nausea, vomiting, stiff neck, and light sensitivity. You might also experience sudden weakness, seizures, or loss of consciousness. Not everyone experiences all symptoms, and severity varies. If you or someone you know experiences these signs, especially a sudden excruciating headache, don't wait, call 911 or get to the nearest emergency room immediately. Time is of the essence with brain aneurysms. The sooner you get medical attention, the better the chances of a positive outcome. In the next chapter, we'll discuss reducing your risk of developing a brain aneurysm. So stick around. We've talked about what brain aneurysms are and the scary symptoms they can cause. Now let's shift gears and talk about what you can do to protect yourself. While you can't control every risk factor for brain aneurysms, there are some lifestyle choices you can make to significantly reduce your risk. First and foremost, if you smoke, quit. I know you've heard it a million times, but it's worth repeating. Smoking damages your blood vessels, making them weak and more susceptible to aneurysms. Next up, manage your blood pressure. High blood pressure is a major risk factor for aneurysms, so talk to your doctor about getting it under control. This might involve lifestyle changes like diet and exercise, or it might require medication. Speaking of diet, what you eat plays a huge role in your overall health, including the health of your blood vessels. Focus on a balanced diet that's low in saturated and trans fats, cholesterol, and sodium. Load up on fruits, vegetables, whole grains, and lean protein. And don't forget about exercise. Regular physical activity helps lower blood pressure, improve cholesterol levels, and maintain a healthy weight. all of which are good news for your blood vessels. Now, I know life can get hectic, but make time for stress management. Chronic stress can contribute to high blood pressure, so find healthy ways to cope with stress. Whether it's yoga, meditation, spending time in nature, or listening to your favorite music. Finally, if you have a family history of brain aneurysms, talk to your doctor. They might recommend regular screenings to catch any potential problems early on. Remember, prevention is always better than cure. By making healthy choices, you can significantly reduce your risk of developing a brain aneurysm and protect your brain health for years to come. Up next, we'll delve into the treatment options available for brain aneurysms. Stay tuned. Okay, so what happens if you or someone you love is diagnosed with a brain aneurysm? Well, the good news is that there are effective treatment options available, and the best course of treatment will depend on several factors, including the size, location, and whether the aneurysm has ruptured. For unruptured aneurysms, doctors might recommend a watch and wait approach, especially if the aneurysm is small and not causing any symptoms. This involves regular monitoring with imaging scans to keep an eye on the aneurysm and make sure it's not growing. If the aneurysm is larger, faster growing, or causing symptoms, more proactive treatment might be necessary. One option is surgical clipping, where a neurosurgeon will access the aneurysm and place a tiny metal clip across its base, effectively cutting off its blood supply. Another option is endovascular coiling, a minimally invasive procedure where a catheter is threaded through an artery in the groin up to the brain. Tiny platinum coils are then released into the aneurysm, filling it up and preventing blood flow. Now, if an aneurysm has ruptured, it's a much more serious situation that requires immediate medical intervention. Emergency surgery is often necessary to stop the bleeding and relieve pressure on the brain. Recovery from brain aneurysm treatment can vary depending on the individual and the extent of the condition. Some people recover quickly with minimal complications, while others might face a longer road to recovery with ongoing challenges. The important thing to remember is that there is hope. With advancements in medical technology and the expertise of skilled healthcare professionals, there are effective treatment options available to address brain aneurysms and improve patient outcomes. In the next chapter, we'll discuss some notable cases of people who have been affected by brain aneurysms, highlighting the importance of awareness and early detection. Don't miss it. Brain aneurysms don't discriminate. They can affect anyone, regardless of age, background, or walk of life. And sadly, there have been many notable figures who have lost their lives to this often silent killer. One of the most well-known cases is that of actor John Ritter, best known for his role in the sitcom Three's Company. Ritter tragically passed away in 2003 at the age of 54 from a ruptured aortic aneurysm, a type of aneurysm that affects the aorta, the main artery that carries blood from the heart to the rest of the body. Another heartbreaking case is that of singer-songwriter Laura Branigan, best known for her 1982 hit song Gloria. Branigan died in 2004 at the age of 52 from a brain aneurysm. She had reportedly been experiencing headaches for several weeks before her death. In 2006, the world mourned the loss of legendary musician Syd Barrett, a founding member of the band Pink Floyd. Barrett, who had battled mental health issues for much of his life, died from complications of pancreatic cancer, but he had also suffered a brain aneurysm years earlier. These are just a few examples of the many lives that have been cut short by brain aneurysms. Their stories serve as a stark reminder of the importance of awareness, early detection, and seeking prompt medical attention if you experience any unusual symptoms. By learning about brain aneurysms, recognizing the warning signs, and taking proactive steps to manage your risk factors, you can play an active role in protecting your brain health and the health of your loved ones. Remember, knowledge is power. Share this information with your friends and family, and let's work together to raise awareness about this often silent but potentially deadly condition. So there you have it, guys. We've covered a lot of ground today. From what a brain aneurysm is to the warning signs you should never ignore, prevention tips, treatment options, and even some notable cases that highlight the importance of awareness. Remember, brain aneurysms can be silent threats, often causing no symptoms until it's too late. That's why it's crucial to be proactive about your brain health. Know your risk factors, Make healthy lifestyle choices and don't hesitate to seek medical attention if you experience any unusual or concerning symptoms. If you found this video helpful, give it a thumbs up and share it with your friends and family. And don't forget to subscribe to my channel for more informative videos on health, wellness, and everything in between. Stay informed, stay safe, and take care of your amazing brains.